If you're new to the show, you may not know that infertility is an issue that I'm very passionate about. The statistics show 1 in 6 couples struggle with what the CDC has now called a disease. And my husband and I are one of those couples, and Dr. Julie Lamb's going to talk to us in just a second about this. But wanted to tell you that after 9 years of trying and getting medical help, we are finally having our first baby. There was our ultrasound from a few weeks ago. And a lot of you may know this, but I am now 16 weeks along. And the reason I'm giving you an update is because we're learning more about infertility as a whole. The New York Times just came out with a report that fertility is, or I should say, is it fertility? It's fertility rates,
yeah.
Birth rates have hit an all-time low. So Dr. Julie Lamb is here from Pacific Northwest Fertility. This is interesting, but you're saying it's not really surprising?
Right, interesting but not surprising. We're certainly seeing the average age of patients trying to get pregnant be a little bit older than it was even a decade ago.
Yeah, because like when our parents were having babies, they were having babies in their 20s, and now people are just waiting for their careers, or what?
Yes, absolutely. So this next generation, we're delaying getting married, and we're doing more education, and we're climbing the corporate ladder, and making sure everything's perfect before we take that approach to parenthood. And
kind of paying the price for it, really.
Right, yeah, definitely. I think that these new birth statistics make a big effect. They make it look like, that one group that's growing is 40 to 44, and it's not easy, as you experience.
Right.
Like, it can be a challenge even when you're in your 30s. So doing things to look out for your fertility is always suggested.
Okay, I'm wondering, we are 1 day away from Advocacy Day, and that's when all these people go to Washington, D.C., they go to lawmakers and say, something needs to change. So what needs to change for parents, or for women, or for men? What needs to change in the world of infertility?
Some of it you're doing right now, just raising awareness for infertility and its consequences. Other things that they're doing for advocacy is increasing access to care. So trying to get care for everyone. Not everyone can see a fertility doctor or afford care, especially they're specifically looking at veterans and getting resources for adoption and IVF.
Because it's so much money for people, and if the CDC calls it a disease, why can't people get health care for it?
Right.
Okay, so on top of that, what are ways that people can take their reproductive health in their own hands? I mean, because we're taking our careers in our own hands, what can people do to take their reproductive health in their hands?
Yeah, so knowledge is power. Just learning about your fertility, learning where you are in that fertility window, checking your AMH, asking your healthcare provider about your fertility. Taking good care of your reproductive health as far as eliminating toxins and not smoking and minimizing alcohol, and then just learning about your options. If you are going to wait till you're a little bit older to have your first child, look at what your fertility preservation options are.
Some of that, what you said about toxins, some of it is easy, right? Like don't smoke, don't drink as much. But like we're learning things about plastics and like all these things in the environment as well, which makes it tricky.
Right, there's more than we ever imagined. So cleaning that up as much as possible as well. All the unknowns.
All the unknowns. Thank you so much. We really appreciate it. Always love having you. I do want to mention that if you want to know more about Advocacy Day or what you can do to educate yourself, you can text the word RESOLVE right now to 206-448-4545, and we'll kick you back a link to give you some more information. In the meantime, let's go back over to the folks over at the table.